screen.
Great. So it's a big honor today that I have Elisabeth Schlegel back with us since she departed Zucker School of Medicine and now is in Freeport, the island of Freeport, at a new medical school that is forming. And really excited to have her present this journal club because she was instrumental in starting scholarly concentrations at the medical school. Elisabeth and I co-ran the medical student as teacher, which started as a small elective and then blossomed into a scholarly concentration. And of course, we have other scholarly concentrations under the leadership of Tiffany Jordan, who's joining as the discussant today. And Tiffany oversees all the scholarly concentrations. And we're blessed at the Zucker School of Medicine to have how many scholarly concentrations total, Tiffany?
5 total.
5 total, and probably more coming. So
Hopefully.
this is a big trend in medical education, scholarly concentrations, and there's a parallel process actually in residency or graduate medical education training, because many graduate programs for residents have what they call tracks, and residents specialize within their residency in a track, and it could be very similar to this. It could be teaching, it could be global health, it could be leadership, it could be research. So there's a parallel process happening, and learners want more specialization, even though medical education in itself is specialized. So I'm really excited to have Elisabeth Schlegel here, who was greatly involved in scholarly concentrations, and maybe she'll be doing some of that work where she is now. And Tiffany Jordan, who leads us in a way that is just miraculous in our scholarly concentrations, because she keeps them all straight and keeps us all on track. And we all have our little quirks about our concentrations. And I really, really thank her immensely. And I'm glad she can be the discussant. We're doing one article today. If you look in the literature, there are many articles about scholarly concentrations. Elisabeth picked this article, which I think is wonderful. And I'm going to let her take over. This is being recorded, just so you know, and the recording, of course, will go up on my faculty development website. And we appreciate if you give us feedback on the evaluation at the end, and we'll put that link in the chat as we get closer to the end. And I'm going to turn it over.
Yeah, thank you very much. So Alice, thank you so much for the warm welcome. It's great. It's like I'm here with all my global colleagues, and we are colleagues forever. And students
And
are my
colleagues. I forgot to thank the students who came on. So thank you, students.
Yeah, thank you. Student perspective is so important. And also I have one team of my blog here, and this is Janine. Sorry, I'm calling you out, but it's just so great that you have us join us. This is fantastic. Can you give me a brief thumbs up that you see my screen?
Yes, we see your screen.
Yes.
It's beautiful.
Awesome. Okay, fabulous. So in order to leave time for discussion and without any further ado, I'd love to start. This is about Journal Club about, starting scholarly concentrations in medical school, and it's all about fostering a culture of inquiry and curiosity. And let's see what we got today. Okay, I have nothing to disclose. And Alice asked me to start with a question. So, fellows, guys, friends, what is your experience with students or trainees seeking a specialized knowledge and skills in addition to their role as clinician?
And I think this is a great place for a student maybe to say why they sought specialization, and any of the colleagues on here could follow. Maybe one of the students could say that.
Right. And if you don't want to speak, then just write it in the chat. And Tiffany, pretty please let us know what we.
Sure. Yeah, I'm monitoring the chat for those who prefer to talk.
I can address this question. I decided to pursue the concentration because I knew that as a trainee, part of that role would be to teach my peers, my patients, and those who come after me, meaning as an intern, I'll be teaching the medical students. As a senior, I'll be teaching my juniors. And I thought this is something that I'd rather have the skills now going into it than have to learn it while I'm doing it. and give me the ability to communicate this. And really, I think communication is one of the forefronts, and for me personally, of why I pursued this.
Fantastic. Thank you very much. So I'm writing down what some keywords that kind of stand out. So communication, and that is really key. Thank you so much, Alexis. And we have to
Anybody,
end. Yeah.
anybody else?
So Stacy shared in the chat, she said in her work, she finds a number of trainees are looking for specialized skills in academic tracks. They would like to be able to teach as well as practice medicine. And with that comes specialized skills in disseminating their work and getting published. So really trying to hone those specialized skills that may not be addressed more generally.
And Tiffany, what's been your impression as somebody so deeply engaged in scholarly concentrations?
So I think similarly to what Stacy said, I find that students really come to us with a passion and interests that really resonate deeply with them. And one of my favorite parts of my job is getting to help those students find opportunities to meet those needs and to meet those passions. So I think it's mostly for the undergraduate medical students to really discover opportunities.
Okay, Elisabeth, you want to go on? Was there another comment in the chat? Wait, there's one more.
Just one. I'm the Melanie Jessel said, I'm the director of counseling, so I'm not involved in curriculum, but I do have students seeking some related information skills, such as working on test performance anxiety or managing professional relationships and conflicts.
Well, that certainly works into leadership roles.
Yeah.
And another comment, while working with child psychology externs, they are seeking specialized knowledge and skills to advocate, such as trauma-informed care for a vulnerable population. So that goes back to really looking for specialized skills that maybe are not as addressed as deeply as learners want.
Okay. Super. This is really rich. Thank you very much. All right, let's go into medias res. Okay, so very briefly, my learning objectives, and it's just really formality. So after this session, I would like you to walk away from here and be able to identify the key components of such a scholarly concentration, give me benefits and opportunities, motivations, and I think we already touched on this quite a bit, and also giving me the best practices that we can do for implementation, which is really the heavy lifting that we have to think about. Now, this is the actual paper, and Alice was right, and this is not even super new. So this is from 2019. But what really drew my attention to this one here is it's not just the international moving of curricula, because this is done internationally on a global scale, but this is actually a scholarly concentration, which is a considerably smaller curricular part. And that was moved into a Turkish medical school, which was fairly new, which I think, oh, this is actually a novelty. This is actually quite interesting. I haven't seen this before. So let's go into this, what this really was about. But just to give you a definition. So what are scholarly concentrations? These are elective or volunteer or required extracurricular experiences that give students or generally trainees in residency opportunities to study subjects in depth before the conventional medical curriculum, and most often require a scholarly project. So not all of them do, but they mostly require a capstone. And I know that Tiffany had also a point on this here, I think, in terms of residency. Yeah.
Yeah, I just wanted to chime in. At the Zucker School of Medicine, we have, as mentioned, 5 scholarly concentrations, one that devotes its time to primary care, one in medical education, one is a leadership-focused scholarly concentration, one is humanities-focused, and one is focused on health economics and clinical effectiveness. Our programs are not required. Some schools do require a scholarly concentration. We do not. These are programs that students elect and apply to be a part of. And ours are also longitudinal with touch points in every year of their training. So that's another little difference that I've seen between our programs and other schools.
Mm-hmm. Thank you very much. This is exactly true. Yeah. But also want to add in another very important note that especially now for new schools is really a big deal. And this is also, these fulfill, besides being key factors generally of really being a resourceful and great clinician, right? They also fulfill the requirements of US-based aligned and US accredited and bodies aligned with accrediting bodies. And the exact verbiage that LCME has and that our accrediting body has is self-directed learning experiences that allow students to develop skills, obviously to lifelong learning, but also opportunities, encouragement, and support to work in research and other scholarly activities with the faculty. And this is really a big deal. And we will come to this just in a moment. Now, transforming these things, however, into an international context is new, albeit it's a really good idea. So let's see what's about this. So what are hallmarks of the scholarly concentration? So it's academic enhancement. So pretty much everything that you just heard that Alexis said before and what we heard from Tiffany. And skill development, right? Analytical thinking, creativity, critical inquiry, but also a lot of trainees who go later on, right? They look into career exploration, right? They want to distinguish themselves. They want to give themselves a competitive edge. In a way, they want to be distinct. They want to stand out, either in public health or any related disciplines. And it's a lot of different disciplines at this point. But here's a point, and that's why I also put it out in yellow. It's the mentorship. And this is really where the magic happens. It's an individual pairing with students, with a faculty mentor who guides their scholarly project. And certainly students can work in groups, but to have this very intimate guidance very early in your career or even later, right, at a critical point where somebody really guides you forward, this is really the most important environment. It also gives you a safe environment because you want to look for specialized skills, right? You want to hone your communication. So pretty much everything that we just heard before, this is the one magic person that really could push all that forward or pace you, I mean, if they see, that your academics are not up to snuff, so really make this happen with you. So mentorship is the big key here. So what are other examples of such scholarly concentration? So you heard from Tiffany what the Zucker School of Medicine has. But in my research for this journal club, I was really looking around a little bit. And as an example, there's bioengineering in many different medical schools. How cool is this, right? Or executive medicine, where students really talked about and said, gosh, I could change how the electronic record system is done. Or innovative medicine, if they want to come up with a wearable device or anything of this kind of like medical education, of course, humanities is a big, big, big part right now, right? And this is just really a very, very small part, right? So there's a lot of different concentrations out there, some required, some not. But always it's very innovative, very new ideas, and always they kind of support the students to really hold on and create a product that really makes them special and makes them stand out. So let's take a minute though. So how can offering such scholarly concentrations alongside the curriculum, right, enhance students' engagement with research and critical thinking, but also what potential challenges do you see that might arise from such a program? Write it in the chat or raise your hand and let us know.
So I have someone who says finding time would be a challenge. And I think that's one of the biggest challenges we've seen. How do you find the time to offer something that is not part of the curriculum, especially when the curriculum is so packed? I can address that how we've done it at the Zucker School of Medicine. What we've done is put the bulk of our programs in the summer between MS1 and MS2 year, as well as their MS4 year, which has a little more latitude and flexibility. And that MS4 year is also, kind of designed for students to really kind of hone in on their interests. Also, we've added touch points during the MS2 and MS3 years where it's not as heavy a lift, but there's still kind of a significant touch point and a relationship that because you want to maintain that kind of sense of community within a program as well. So that's one of the ways we have tackled the finding the time challenge. Melanie Jessel says students who have a natural interest. my thing scrolled up. Natural interest in a particular specialty may find it easier to generate research questions. I think that's definitely true. These are self-selecting students sometimes, so they're going to be the ones who, have those interests. Caitlin Duffy says scholarly concentrations can provide students with new perspectives and opportunities to apply the medical curriculum in new ways, fields, and environments. I think that's something we've definitely seen. With our leadership program, we've had students who have completed that summer section and then have campaigned to have parts of that summer offered to the whole population of students because they felt it was important for all of their peers to have that same kind of knowledge base. Dr. Elsie says, in the global level, these concentrations are good opportunities for exposure to different systems and environments. I think that's excellent too.
That's excellent, yeah.
3 challenges come to mind, though. They are cultural competency, priorities, and systems compatibility.
Love it, yeah.
And Janine says, for critical thinking, I think it can enhance students to engage with some medically limited resources in the community. I think that's an excellent point. One of the programs I keep trying to bring to the surface is community health. And there are lots of great programs out there within institutions that are in high needs areas, whether it's a rural medicine kind of program or an urban medicine kind of program. There are some schools that have a specialization in Indigenous people health.
Right.
There's a lot of great programs out there.
Excellent. Thank you very much. Yeah.
Oh, another challenge that they see a lot is particularly with writing and getting their scholarly project published. There's a real issue with underrepresented voices in scholarly literature, and we need to move beyond the self-selection that we always see. I think that's a great point, Stacy. And one of the things we try to do is advertise these programs widely, at least within Zucker. Make sure that the students are aware of these opportunities, and our application process is as blinded as possible, so that way we can ensure that it's equitable to everyone.
That is a very good move. Thank you. All right, then let us see. So yeah, we already touched about in global health, and that's very, very true. It is super important when programs are obviously moved, right? So in this case, it was a move from Hopkins to a Turkish school, that they look into improving health and healthcare globally, right? Also making sure that health disparities are addressed, super important. Then Dr. Elchi also mentioned the redesigning systems of care that might be important. But most and foremost is really partnering with local government and with these academic institutions and really make them the voice, make them the driver of this, to overall develop healthy workforce and including curricular transfer or educational best practices that also fit the local needs. So let's take a look into Johns Hopkins and their concentration. So Johns Hopkins is a classic, I would say, has a classic 2+2 4-year curriculum. Their concentration has, I would say, 5 focus points: basic science, clinical research, history of medicine, medical humanities, bioethics, and public health. And this is about 55 hours. It's 6 modules. It's a faculty monitored experience. Most time is actually spent on their own. So either with the mentor or on their own developing something. That's super important. And especially in the summer, where it's also unscheduled time, they are working on their project. This is super important. And the program goals demonstrate intellectual curiosity. So it's not really a content, it's curiosity, it's self-directed learning, it's coming up with something, right? Presentation skills, critical appraisal, planning, conducting of scholarship. So it's really something that makes a person stand out and different. So what then was the research question here? And well, you guessed it, right? What are the similarities and differences and outcomes from moving a program from Johns Hopkins into a medical school that's fairly new, Beshmil and Vakif, in Istanbul in Turkey? What are the program characteristics, the outcomes? But the overall goals is really, well, it was introducing a novelty. And that's why when you look at the data that I'm going to show you, in a way, it's very, very early, right? They did it just one time and then they published the paper. And usually you wait a couple of years. However, the authors said, no, this is new. We want to show the community how this is done, our best practices, what you have to watch out for, right? So we publish this paper now and we show you. So that's why after a first run, they kind of wanted to offer best practices. And here we go. So let's look at this. Johns Hopkins, 6-module scholarly concentration was put into Beshmielem. Now, they met with the students. They had faculty development, mentor development, and they did quite a bit of trouble. So they made about 10 trips to Turkey to really check this out. And this is necessary. It is really, really necessary to be immersed in the environment, to meet the people, to learn what is needed, right? Because this is not Johns Hopkins tells anyone. No, it's really what does Beshmielem, what do they need, right? In order to make it work. Also, students were student-centered, immersed in this. So they really also, kind of gave their perspective to the Beshmielem students in order to show them how this works. But here's the kicker, and this is really why this is such a great idea. Beshmielem has a 6-year medical school curriculum. Now, this is the traditional, I would say, European way, right? Where you go straight out of high school into a medical school. So the kids are brand new to this, right? They're novice. They really don't know what's going on. They haven't had the depths of research required in a medical school, right? Let alone speaking English. So I do not believe, or maybe they may have had some English in the gymnasium, in the high school, but no way to a point, and I can speak for myself, right, where you can sit down with a scientific paper and take it apart. It's just really a skill that you need to learn. So that's why I think this is a very good model for really novice learners who get in touch for the first time, getting immersed into working with a project. And obviously, Beshmielem's goal was, demonstrate intellectual curiosity, right? Enhance the interest in scientific research. And the school by itself, so Beshmielem, they go back in 1900 and 1800 something, right? It's an old place. They are traditionally very high in publications, so they do really well. So they expected their new students to do really well. So that was pretty obvious. That was probably why they approached Hopkins and asked for that, to really get the students a really good underpinning from the get-go to look into research, how it's done in a medical school. So, question to the audience. What unique challenges do you think these novice students entered coming directly after high school, right, into such a rich environment? And how do you think this can help them then develop lifelong scholarly activity?
And I can hop in and say we see sometimes something similar with students who are coming right into medical school from undergraduate and don't have any time in between in the way of gap years to do some exploration or to do that research.
That's an excellent point. They had no gap. And these students here, they have no gap year. They come brand new, fresh, with 19 years, they start medical school. It's a completely different, and then obviously cultural, right? It's very different. It's a different setup.
I can jump in. I think one of the challenges is just kind of the unknown of research. Like, what does that look like? What does that process look like? And I know the concentration can address that uniquely in that it's longitudinal, just across all 4 or 6 years. So the student can kind of start from the very beginning, kind of come up with a novel question. And I think that's also a really neat advantage of scholarly concentration, is that students can kind of jump in the project from the very beginning, because they are able to kind of come up with their own question, and that sparks their, intellectual curiosity. Whereas a lot of research opportunities, at least from my experience, the project's already kind of been formed, so the students are kind of jumping into it, and so it's not like a novel, project that they're a part of. So I think being able to, kind of be involved in it from the very beginning all the way to the end is a really neat feature. And I think concentrations, because they have the mentorship aspect, the faculty, that's how you can kind of address all the questions and, concerns or anything that might be intimidating.
I think you're right, Garrett, because it really focuses you on a small scope project within an area you're really interested in, and then you have direct mentorship in that area, so it makes the research manageable as you also manage all your medical school curriculum at the same time, and of course, other activities that you have. So I think the concentrations really help to focus students on the research that they're really interested in and guarantee a project can be started and finished within the time frame. So I think that's excellent comment. Thank you.
Thank you,
Thanks,
Darren.
Darren.
Yeah.
We have 2 comments in the chat, and then Dr. Elsie has his hand raised. One of the comments from Melanie: certainly a skilled mentor would be more equipped to foster that kind of thinking and question generation than someone in a traditional instructional role. And I think that's a fantastic point with regard to the leadership program, which I co-direct. Finding those mentors who are experienced as well as have access to teams and projects of a huge breadth, that's really one of the things that makes a difference. Haley said high school spoon feeds students with the things that they need to pass their exams. And so teaching independent thinking and the resilience to deal with perceived failure is not there. And I think that's an excellent point. And Garrett kind of touched on that, where a scholarly concentration kind of gives you that room to fail, and not fail in a bad way, but, try something that really doesn't kind of stick. So those are 2 great points. Thank you. Dr. Elsie, you have your hand raised.
Thank you very much. Just briefly, since I came from that system, I'm the product of that system, I might just shed a little light. Although I graduated from medical school more than 230 years ago, so it's been a while. But the system is completely different from the US AMC curriculum. It is a German school-based curriculum, actually, thanks to Albert Einstein and Professor Schwartz specifically. Actually, that's something good, feel good came out of the Second World War, that all exiled professors, Jewish scholars in Germany, Austria, and Central Europe, actually, with Albert Einstein's support and Kemal Atatürk's welcome, they came to Turkey to establish medical school, engineering, law, arts and sciences, and many universities in Turkey. So we are proud products of those amazing scholars. And this system actually, within 6 years, aimed to produce medical practitioners step by step, based on the mentorship, not only the curriculum and lectures, but I remember my time that we start with a mentor professor, and every year we change mentors and we work with them. We join their research. For instance, my first mentor was a professor of orthopedics, and his research was on shoulder. So I joined his research while I'm learning anatomy, learning rotator cuffs, let's say. I was also helping him in his research without really knowing much of the clinical details, but learning while we are doing. And it was really a great way of moving forward. And as a product, for instance, I was graduated in 1986. Now I look at my classmates really do amazing things all around the world as a product of that system. Now in the AAMC curriculum, it's pretty much mainly aimed to produce medical technicians within the 4-year. They aim to produce practitioners to the system. We don't graduate without becoming eligible to practice. So you need to pass through all tests. After graduation, you go and register to a medical association. Those are the differences in the systems. I think it might be helpful for you in your discussions. Thank you.
Thank
Thank
you
you.
so much. It sounds like that system, the system that you're a product of, really kind of lends itself to a scholarly concentration, which
does.
really leans so heavily on mentorship. So I thank you so much.
It really does.
Elisabeth, I think you have to progress.
Yeah, I will do. Okay, thank you very much. That was a good point. Okay, so why don't I tell you really briefly how these modules actually look like that were transferred into Beshmiel. And these were all in all 6 modules. Please note that there's a count here that's a little bit flexible. Beshmiel chose basic science, clinical science, methical ethics, and the healing arts, history of medicine. So they condensed it a little bit. And I believe in the very beginning, public health and community service was offered, but in the end, students chose products from different projects from different offerings. But mostly these were the times when they met. And all in all, it was really 6 times and at a maximum 2 days. And when I say day, it was really going from, let's say, 9 o'clock in the morning to 3 o'clock in the afternoon. And this was really it. And again, it was not about content, not even basic science. It was all about how to start your project, how to do literature search, how to come up with a research question, how to develop your project. So it was really all about the curiosity and demonstrate your curiosity and your inquisitive inquiry. So very, very interesting. It really seems more the skills and the attitude in order to proudly establish your product and what you want to do and your project and why it is important for you than any other content. So again, 4 modules, that's all it needed when they met and kind of also bonded and moved forward. But there was a very cool end to this. So they had written exams, written reports in the meantime. They also had an academic day event. So they were expected to come up at least with an abstract and to all present in a presentation, which I believe is a really great idea and would really work for any medical school. Now, in the interest of time, guys, let me move forward in order to, So what is the assessment, outcomes, and support? So they had written assignments. So actually it was pretty rigorous, I might say. And they got feedback, first formative and then summative feedback on that. They had a medical student research symposium, actually both in Hopkins as well as in Bergmiale. They had quite a bit of support. And I think this is really, really, really crucial. And Tiffany, you know what I'm talking about, right? When you need support, it's really something that drives the whole thing. And here where it gets really interesting. So what is it actually that I'm going to present on? So the students also got an end of course 46 item baseline rating, process, experience, outcome, impact on future plans. And in addition to this, and I believe this will probably be a follow-up paper that they will present, they also had them do a clinical research appraisal inventory, which is actually, and there's probably, the experts here probably know more about this. This is a tool where you assess self-efficacy in clinical research and your confidence level, which I believe is actually a really brilliant way to kind of measure how are you taking hold of the research endeavor and the path that you were put on. But what else did they do? So they collected the quantitative data in this 46 item that I just let you know. They also collected qualitative data in a basic mixed methods design, the convergent parallel design, because it did both at the same time and not, kind of sequentially. And what they kind of looked for in terms of qualitative was very simple. Tell us your feelings about the concentration from the beginning and what was the most positive aspect. So very, very open. And then they would go ahead and code it and develop themes and go about this. So first of all, we know already what the differences were, but there might already be a very high alert in working with a mentor. So support of leadership was really, really high. They had more faculty mentors at Hopkins, and because they really sourced them across Hopkins, while at Bishmirlem, it's 455. However, I would say, at the beginning, it's probably really good, and it probably really helped them. But, and this is probably something where Dr. Elchi can tell us a little more about, but the paper actually also said, well, in Bishmirlem, the exam scores are still valued for future career success. So it's not actually developing a project, even though they really appreciated it and liked it. So the characteristic of students, we talked about this, that they were different, right? The student number was same, and both students really, really loved it. And again, and this comes a little bit back to what Garrett said before, students took ownership of their projects, right? They really established something, and that was new to them, right? The Schlegel students, they were around 19 years old, right? But now they learned with a mentor in the safe environment to really come up with something that's their own, that will go with them probably for their lifetime. And they also, and the Schlegel students also reported out, well, once we do a project, we probably will keep on publishing for the rest of our career, because now we learned how this works. So while the initial Hopkins concentration was condensed, they kind of came up with the same outcomes, and overall the module time also was the same. It was interesting, though, that the Schlegel students said, well, actually, we would like to have more class time. And there was one difference that I read, how they used this time when they were together in these modules. They actually had exercise sessions. So this is really, you know, when they were told probably how to write an abstract, and then really the group got together and wrote these abstracts in groups, and probably also, you know, critique them, which is really way to go in order to get this done. So faculty mentorship is a key. Students also, you know, chimed in from Hopkins into this process to really, really help them out. And again, at both sides, a medical student research symposium was the very desirable endpoint for presenting your product that you proudly did. So I would like to show you a little bit of a breakdown, and it's interesting. Hopkins has a rich history in doing these concentrations. While this was the first one for Schlegel, right? Now, in Schlegel, I would say the focus point that were most chosen, and the projects that were mostly chosen, were basic science and clinical research, which doesn't really surprise me, because Schlegel is supposed to be a really a research center where they get research papers out. I was not quite sure. It was reported in the paper that public health community service was not a possibility for Schlegel. There was a number that I saw. It might have been to both. So what I understood, it was either medical ethics and healing arts. And remember at the beginning when I said they condensed it all together, I believe this was probably where the third number of most projects came out with. But overall, students were very happy and students were very engaged, and they really loved it to take ownership of their own projects. Now, what was their qualitative response when they were asked sort of in the middle of this whole course? So it was kind of an eye-opener, right, for our Turkish young students, where they said, gosh, you know, this is really a lot of work, this is really a lot of effort, but I learned how to review the literature. I know how to do an IRB, right? This is the application for the ethical committee, super important. And yeah, makes sense, right? Science discovery, work in a laboratory, right? Importance of scientific research projects. So this is really where the rubber hits the road. So where to? There seems to be also kind of flexibility going on. Mentors left, I have a new mentor, these things happen, right? The time frame was questioned a little bit. And of course, the English literature, yeah. And I can feel this on my own, coming from a German-based background, right? We had seminars in order to really tackle with English literature, because it's new when you are really a new student. But at the end, of course, gosh, they really had this sense of self-efficacy, right? They did a project, they really knew what it is. So the sense of this, it was a sense also of being initiated in the profession. I'm now a professional or at work, right? I create a project, it's important. This is a standalone thing, this is really what it is. They were able to present that they had developed and mastered a skill, and they had also been able to understanding the steps, writing articles. So all the things new, you know, that they really were able to do. So overall, I would say great outcomes for a first run, and a lot of good things, while there's probably a lot of weaknesses that they can improve. No question about that. So pretty much overall, it has been a successful implementation. And it's interesting because across Europe, and Haley can probably kind of second that, right? There are different degrees of more or less formal research programs in schools, in medical schools, and also basic science schools. And I'm saying this because wherever there is a mentor or a lab or just an idea, a group will form and come up with something. And it might be very informal, as long as, you know, there's a group, there's some meetings, and there might be a paper coming out at one point. So there's a lot of formal, informal programs that are not definitely called concentrations, but they do exist. And also when you think back to when I think back to other medical schools where I worked, there were such informal programs that were very successful and produced a lot of projects and even papers, right? That didn't really have an official name. So it is a thing, but it can be formalized, no problem. Now, one of the key, and this is so important, is mentor development. Having a mentor cohort and letting them know what is necessary is really super important. The Hopkins faculty reported that specific sessions had to be done simply, in order to let them know, what might be important, what findings might be there, but also, in order to really include them, they made sure that they were invited to specific sessions, to doctoral sessions, simply to experience how this is done and also where can this go. So really did a lot of inspiration in order to make sure that the mentors know how to move the students forward, right? Then one thing, and this is, I understand, is probably a minor problem for us, but for accreditation per se, it is a big deal. Of course, Turkey, Europe, right? We had to think about the European transfer credits. And whenever you have an international context, right, transferring off the program or transferring and accreditation is always a big deal, whatever program you do. So this is a sensitive and very important item. And then, of course, and this is something that was brought up at the very beginning here, logistics and fitting into a curriculum. And usually curricula are already very rich and dense. So this is an ongoing question, how to do this. So this is really a big deal.
Elisabeth, if I can just jump in,
Yeah.
I know because the mentorship is such a crucial part of these programs, and people are like, how do I get mentors? How do I keep mentors? And we did a recent study on the mentors who work in our leadership program, and we anecdotally had heard, year after year that it was the best summer of their life. They had such a great time, but I wanted to know why. And it seemed that we did a whole structured interview and looked at it qualitatively, and the mentors really believed in giving back. That was one of their prime motivations. And they were able to get work done on projects that maybe hadn't been able to be moved forward because they just didn't have the manpower. So it really comes down to also a win-win situation where the mentors are getting the help that they need and the students are getting the opportunities and access that they're looking for as well.
This is an awesome point. And I mean, it's a win-win situation for both. And this makes it so collaborative and so great. And yeah, thank you very much. And I see that some folks have to leave. Well, thank you very much for joining us. And I believe after that slide, there's one more question before I move it over to our librarian. So how does this concept of scholarly concentrations align with specialization tracks in residency training programs? And this is kind of beyond, right? This is where we all want to get our students to, and our students where they all want to go. So perhaps, Tiffany, can you give us a little bit of insight, since we don't have a residency director here today?
Sure. Just anecdotally that I've heard that there are many programs such as internal medicine, pediatrics that do offer tracks, whether it's in education, public health, quality improvement, where residents are really a lot of the time to specialize in areas that either they're interested in or that are very important to that specialty. So I think that's a growing trend, definitely making its way towards more and more specialties as well.
And do you think it's a good idea to kind of, talk to residency director and say, gosh, you have this medical education track. What are you looking for in an applicant, No,
I think what we're doing by, starting this kind of idea in undergraduate medical education is kind of almost creating a pipeline. So that way students are kind of even more prepared to go into a residency that may have a track such as that.
Yeah. Super. Thank you very much. I have to have this in mind when I talk to our own students here. And yeah, on that note, I would like to give it over to our very own Liana Sterger.
Hi, I'm Leanna. I'm the Scholarly Publications Librarian for both the school and Northwell Health. And I'm going to talk a little bit about the bibliometrics for this month's article. These metrics come from both the Dimensions database and the publisher's website. So this article has been cited 3 times since it was published in 2019, including once in the past year. And it's been saved 62 times via the Mendeley Citation Manager, which indicates that the user is interested in like going back and rereading it or reading it for the first time and potentially using it in their own research. 24 of those saves were in the past year. So this kind of, along with the recent citation, indicates that people are still really quite interested in this even like 5 years on. As far as social media attention, it's been shared 8 times on X, which is formerly Twitter, and once on Facebook. And in addition to that, the full text has been accessed 2,110 times from the publisher's website.
That
Thanks,
sounds like a,
Leanna.
yeah. Mm-hmm. Thank you very much. Now I'm just saying that sounds like a really high number. Okay, thank you very much. Fantastic. Mm-hmm. So we put Liana forward because Alice initially said, oh my gosh, we never get to this point. But in order to really close out the session, let me give you guys the summary and the future perspectives, of course. So this was really successful, but it was the first time that a scholarly concentration, a smaller piece, right? Modules, yes, would put in an international context, right? It was really, really new. And the barriers that were kind of mentioned throughout the paper, they were always overcame with passion and, and moving forward and the novelty. So it seems there is such a need out there for really establishing something in a one-on-one collaborative fashion, right? It really comes up with the project. That's super important. And that really makes you transcend all the stuff that you have to deal with. So there was a lot of enthusiasm amongst the faculty and amongst the medical students. And you know what? That really feeds on everybody, right? You love that when your students love it, what you're doing. It's just a really, really cool thing to do. Students from both institutions indicated they were probably doing scholarly work in the future. And scholarly work is really one of the things that's proportional to really securing a residency spot. So this is super important, no matter where your medical school is. This is really the key point. And one additional thing, and that's what I also want to keep in mind, a lot of students actually chose Bashmir exactly because now they offer this concentration. I think this is a lesson learned. This is something that any school can kind of think about to kind of use this to really attract applicants who volunteer and say, hey, this is something that I definitely want to do because this is my interest. It really sings to my heart. So the long-term outcomes for Bashir were including careers in research productivity, and there will probably be another paper coming out and telling us more about that. But so far, I think this is a great success, and I'm really glad I had the opportunity to present this paper. And I'm thanking you all for being here with me. And let's see where we can bring these ideas forward. And I'm saying thank you very much. And usually, Alice, but also in my own place, it's kind of, oh my gosh, make sure that everybody learns about this service, right, for feedback. There is a survey link. I think you will either receive it or it will be sent in an additional email. But please, please.
Deanna just shared it in the link. In the chat, rather. Thank you so much.
Fabulous, super. But please fill it out. I learned by now to have to say this at the very end of my sessions. Very important. The next speaker, and as you know, I share the journal clubs also with my own faculty here, is Ethan Fried, Associate Chair for Education, Department of Medicine, Professor of Medicine. We know each other very well. So this is next year. Oh my gosh, think about this. It still says 2024, but it's definitely 2025. So I'm looking forward to see you guys then hopefully at this point. And with this, I wish you a wonderful, wonderful day. And yeah, thank you very much for coming with us to Johns Hopkins and Bashmir. Thank you.